Profunda stage can get dermatitis infection with Staph aureus or MRSA. It is a common complication, and the skin is desquamated by applying 1% salicylic acid to the affected area 3 times a day. Then heat cramps. They are painful involuntary spasmodic contraction of the skeletal muscle, though mainly the calves. They involve the thighs and shoulder as well. They occur due to sweating profusely and replace fluid and water and electrolyte losses. They occur during exercise or most commonly during rest period following several hours of vigorous physical activity. They do not cause significant morbidity. They are self-limited, but the pain is very severe. The main treatment is hydration and salt replacement. They almost never cause rhabdomyolysis. There is a relative deficiency of sodium, potassium and magnesium in fluid at the muscle levels, hyponatremia, hypochloremia. So the treatment is supplement fluid and all the electrolytes and rest in a cool environment. For mild cases or if an overwhelming number of patients require treatment, 1 to 2% saline solution can be given oral also. 2 650 mg salt tablet dissolved in a quarter of water. Sports drinks are commercially available, which are much more palatable than salt. IV hydration can be used. Heat stress. What are the clinical features and diagnosis? So, sign and symptoms of heat emergencies. Heat cramps, there will be muscle cramp, normal to mildly elevated temperature and sweating is preserved. In heat stress, the fluid and electrolytes are lost. The symptoms are seen in heat cramps plus the normal to elevated temperature, which is but less than 40 degrees Celsius, less than 104 Fahrenheit. There will be nausea, vomiting, headache, malaise, dizziness, and orthostatic hypotension may be there. In heat stroke, which is the worst thing, there will be neurological signs and symptoms. Symptoms seen in heat stress plus elevated temperature more than 40 degrees Celsius or 104 Fahrenheit. Neurological abnormalities like inappropriate behavior, confusion, delirium, ataxia, coma, seizure, and there is no sweating. Heat stress is treated with fluid and electrolyte replacement and rest and cooling. Heat stress with an elevated temperature can progress to heat stroke even after the patient is removed from the hot environment. Therefore, patients with heat stress who do not respond to 30 minutes of fluid should be cooled until the core temperature drops to less than 39 degrees Celsius. What is heat stroke? Heat stroke is an acute life-threatening emergency with high mortality and fatal if left untreated. The cardinal feature of heat stroke are hyperthermia, more than 40 degrees Celsius or 104 Fahrenheit, and altered mental status. It admits anhidrosis. CNS cerebellum is sensitive, so there will be neurological findings, bizarre behavior, combative, hallucination, plantar response, decorticate, posturing, status epilepticus, coma. The distinction between exertional and classical heat stroke is not clinically important because immediate cooling and support of organ system is the therapeutic goals for both. A history can make the difference. Diagnosis, there is no diagnostic test and the DDs are extensive, so it is mostly history and clinical presentation. Lab evaluation, end organ damage, helpful study CBC, metabolic panel, ABG coagulation, CPK, myoglobin, urine analysis, chest X-ray, ECG, NCCT, head LP वगैरह कर सकते हैं. What are the differential diagnosis of heat stroke? Infection, which can cause anything, can cause altered mental status and raised temperature like sepsis, meningitis, encephalitis, malaria, fever. Endocrine, thyroid storm, pheochromocytoma decay. Neurological like hypothalamic bleeding or infarct, pontine hemorrhage or infarct. CVA, status epilepticus. Toxic like anticholinergic toxicodrome, sympathomimetic, salicylate, serotonin syndrome. Malignant hyperthermia, NMS and withdrawals, alcohol and benzodiazepine withdrawal. प्री हॉस्पिटल में कैसे टेक करना है हीट स्ट्रोक के लिए? Remove the patient from the hot environment, prevent and perform standard resuscitation measure. Glucose check करना, cool by removing the clothing, spray the patient with water, provide airflow under the patient, place wet towels or sheet over the patient body or place ice on the patient. Then ED resuscitation. ED resuscitation, the goals of therapy are immediate cooling and aggressive support of organ system. तो दो काम करने हैं, immediate cooling and aggressive support of organ system. Continue standard resuscitation measure IV fluids at a rate that ensure adequate urine output. In elderly patients or patients with cardiovascular disease, consider invasive monitoring. Check glucose levels and monitor core temperature with an electronic rectal thermometer. Cooling techniques, there are different cooling techniques. Evaporative cooling, immersion cooling, ice pack on the neck, axilla and groin, cardiopulmonary bypass, cooling blankets and lavage. तो evaporative cooling, evaporative, immersion, ice pack, cardiopulmonary bypass, blankets and lavage. So in evaporative cooling provides effective cooling, readily available, practical. It can cause shivering. It is less effective in humid environment. Evaporation क्या होता है, तो पसीना उड़ रहा है बॉडी से. Immersion cooling, आपने ठंडे पानी में डुबो दिया. Ice pack on neck, axilla and groin is contact cooling. And cardiopulmonary bypass provides fast and effective cooling, but it is invasive and not readily available. Setup is labor intensive and it has more complication. Cooling blankets are easy to apply, same as contact वाला जो था ice वाला. And cold water, gastric, urinary bladder, rectal and peritoneal lavage, they are advocated to cool the core when cardiopulmonary bypass is not desirable or possible, but efficacy is not validated. What are the complications of heat stroke? So early and late complication. Early complication can be hypotension, hypothermia overshoot, hyperthermia rebound and muscular rhabdomyolysis, delirium, coma, seizure, heart failure, ARDS, oliguria, hypokalemia, hypernatremia, hyponatremia can be there. Late complication can be cerebral edema, NCAF, persistent neurological deficit, myocardial injury, ARDS, renal failure. Renal failure and rhabdomyolysis is a very big complication. Intestinal ischemia, pancreas, hepatic, hyperkalemia, potassium, calcium, hyperuricemia, thrombocytopenia, DIC. All these can be there. How do you dispose these patients? Patients with minor heat emergency syndrome like heat edema, heat cramps, heat stress, prickly heat require only ED treatment along with clear discharge instructions and OPD follow-up. However, patients with underlying diseases such as heart failure or renal failure and severe electrolyte imbalance require hospital admission. Replace the fluid and the electrolytes, provide them cool. Patients with heat stroke require admission to a unit providing care at a level appropriate to the patient condition. Patients who are intubated are in hemodynamically labile condition, require invasive hemodynamic monitoring or need continued cooling, should be admitted to the ICU. Then there are special populations of the elderly. They have a higher mortality rate and suffer more complications with heat stroke because they produce more heat, plus they have impaired the sweating mechanisms. Elderly who lack mobility, have pre-existing medical illness, take medication that may affect thermoregulation or ambulation, or sleep on the top floor, are particularly susceptible to heat stress. Young children lack adequate thermoregulatory and sweating capabilities and do not instinctively replace their fluid losses or limit exercise in extreme heat, or may be unable to remove themselves from risky environment such as closed car in the sun. Teenager and pre-adolescent are at risk because they may use poor judgment when exercising in high heat and humidity and may push themselves to the limit. Early season high school heat stroke deaths are the most likely to occur during the first 4 days of practice. And children require 10 to 14 days to achieve an appropriate acclimatization response. That's why we used to have summer vacations. How to prevent it? Summer vacation. The Center for Disease Control and Prevention. First, decrease or reduce strenuous activity for cooler parts of the day. Wearing light and loose fitting clothing. These are very important, very, very. In fact, everyone should hear it right now. We are in a month of May and it's hot as hell. So we need to implement it ASAP. First, decrease or reschedule your strenuous activity for the cooler parts of the day. तो ज़्यादा काम जो है ठंडे टाइम में करना है, रात में या अर्ली मॉर्निंग. सेकेंड, वियरिंग लाइट एंड लूज फिटिंग क्लोथिंग्स. कोई ज़रूरत नहीं है एकदम टाइट अंडरवेयर पहन के, पूरा सूट वूट पहन के ऑफिस जाने की. थर्ड, increasing carbohydrate intake and decreasing protein intake to decrease endogenous heat production. This too I can't do. It is asking us to increase carbohydrate intake and decrease protein intake. No. Fourth, drinking plenty of fluids even when not thirsty. Yes. Avoiding alcoholic beverages. Using salt tablets as well as fluid. So not just water. You need electrolytes as well. You need your salt as well. Avoiding direct sunlight and taking advantage of the shade. Community health officials and government leaders should recognize the need to educate the public, coordinate and plan the implementation of these measures in advance. What was the measures? Reschedule strenuous activity to the cooler parts of the day, wear a light and loose fitting clothing, increase your carbs intake, limit protein intake, and drink plenty of water and the fluids and the salt, avoid alcohol, avoid direct sunlight and be in the shade. Thank you.